Hi, my name is Molly Asper, and I'm a Doctorate of Nurse Practitioner student attending the University of Utah. My focus is in primary care adult gerontology. It is an honor and privilege to be able to attend the Surge Symposium poster presentation, and I am excited to tell you about this quality improvement project in which I worked on improving pneumococcal vaccination rates for the older adult population 65 years and above living in a rural area. So, we all know that pneumonia is a huge problem, especially in the older adult population. Pneumonia is one of the top causes of morbidity and mortality in people 65 years and above. Especially now more than ever with COVID-19, it is important for older adults to have not only their pneumonia vaccinations, but also all other vaccines. The clinic where this project took place had consistently low pneumococcal vaccination rates. Working together with the clinic, along with the use of evidence based literature, we were able to develop and implement a toolkit that included three things. Number one was a clinical workflow algorithm in which patient reminders were placed in the electronic medical charts of patients that had not received their pneumococcal vaccines. Number two was a staff education, which include an educational session at a staff meeting. Number three was patient education. This included patient reminder letters that were sent out along with educational posters placed in the patient rooms of the clinic. After the implementation of this toolkit, we measured the success of the program based off of the feasibility, usability, and satisfaction of the toolkit, but also looking at the pneumococcal vaccination rates pre toolkit to post toolkit. As you see in the center of this poster, our most significant result of this quality improvement project was a increase in pneumococcal vaccination rates. Pre toolkit was at 57% in vaccination rates. Post toolkit, pneumococcal vaccination rates were at approximately 64%. This was a significant improvement that we were able to see. Staff overall felt the project was feasible and that they were comfortable in discussing pneumococcal vaccinations with their patients. And looking at usability or the intent to continue to use the toolkit, responses were varied. Overall, clinical staff were satisfied or somewhat satisfied with the toolkit. We do have some barriers that were found in the project, and some of these barriers included that patients had received their vaccinations outside the clinic, making it tricky to be able to track if they had gotten their vaccines. Additionally, with the older adult population, many patients had a hard time remembering if they had received the vaccine or not and opted to not have it. Another issue was that the healthcare system that I was working with was only tracking one of the available pneumococcal vaccine variants. Thus, the most current vaccine recommendation for the PCV23 was not being tracked. Um, it was a slight disappointment that we were not able to get to the 70% pneumococcal vaccine requirement for the clinic's federally qualified health center reimbursement. But um, overall, it was impressive to be able to see an increase in pneumococcal vaccine rates. A second phase will be extremely beneficial to this project, this quality improvement project, in order to further determine how each part of the toolkit impacted the vaccine rate. And for for sure, this project has the potential use as a good resource for other rural clinics that aim to increase their patient vaccine rates. Thank you for your time.